Welcome everyone. This is Angelique Beslic, and you are in the right place. You are in the Tuesday afternoon healthcare supply chain hub, Learning Bytes. But we have a guest today who is absolutely amazing, Sophie Rutherford. She is the Director of Strategic Accounts at GHX, and she is going to walk us through Cloud ERP. And I'm just so excited that you're here, Sophie. Thank you so much for joining me in my amazing weekly podcast. And here we are. So we're ready for you.
Awesome. Well, thank you for having me. I appreciate the time and I appreciate everyone that's joining so late in the afternoon for some of those on the East Coast. But yeah, I'm excited to talk about this really fun topic, Cloud ERP. I know it's been very, very important for a lot of organizations in the last couple of years. And so I think it's definitely time to start talking about what do we do after cloud, right? Like what's on the other side of cloud. So we'll go through a few slides here. I know we have only 30 minutes, but I do have a ton of content here. And I know Angelique will send the slides out along with the recording after. So I will not go through every detail on the slides because there is a lot, right? If anyone has implemented cloud, if you're implementing cloud, or even, thinking about implementing cloud, it's a lot. It's a lot to consume. It's a lot to think about in terms of the technology part, the operations, and then, what is cloud? And so we'll talk a little bit about the difference between on-prem, which is kind of the legacy systems that everyone may be familiar with, and then also the cloud ERP systems. We'll talk about the advantages and disadvantages of both, right? And then also the gaps that you need to be aware of because cloud does not solve everything. And so we'll go through some of that. As I mentioned, I have a lot of content, but I won't go through everything here. I just want to make sure that everyone understands the difference between on-prem ERP or MMIS systems. ERP is Enterprise Resource Processing System, and MMIS is Materials Management Information System. So the difference between on-prem and cloud, on-prem is typically behind your firewall in your network. It is a subscription that you purchase specific for your organization, typically has a server interface, and that's why we call it on-prem, because your server is on premise in your data center. Behind lock and key, right? So this is your instance of that system that can be customized and fit to your organization. Cloud, we'll go into that on the next slide, is a little bit different. But the on-prem is, if you think about some of the legacy systems like Meditech, McKesson, Pathways, I may go really far back in the ESI and some of these older systems that, again, have a server interface with your network behind your firewall. So
Hey,
the
Sophie,
disadvantages, yes.
did you know that my organization just went through a cloud upgrade with Infor last
Did they?
September?
Okay. And you went from which on-prem system?
So we actually went from Infor Lawson over to Infor Cloud Suite, and that
Right.
was for HR, finance, and supply chain and payroll and accounts payable. That was a fun project.
And your organization
Yes.
thought it was going to be easier because you went in for.
Ye- Well, you always think that, yes.
Right. And that
Okay.
absolutely could be misleading that you're going from Infor on-prem or Infor Lawson to Infor Cloud. It really is two completely different systems, right? And I'm sure you've experienced that, Angelique, with your migration.
Truly.
Yeah, yeah. So we won't spend a lot of time on the on-prem solutions because that's the past. Everybody's kind of moving forward to the cloud system. So as you mentioned, Infor, the other two major cloud ERP systems that you'll hear in the market are Oracle and Workday. And like you mentioned, Angelique, there are multiple components to these cloud ERP systems. So the majority of the organizations go with HR, finance, payroll, supply chain, but all of these systems, so you know, were not built for healthcare. And so for those of you in healthcare, you're probably experiencing some of the pain around implementing these systems in a healthcare organization. They are not the end all be all for healthcare. However, they do take healthcare organizations into that cloud tenant where you have better security against any risks, cybersecurity risks. And we'll get into that here in a few slides around the advantages of cloud. But as I mentioned, most cloud ERPs were not specifically built for healthcare. Most were built for manufacturing. And so the supply chain management module, specifically for this audience, the supply chain management modules were built for manufacturing. So you will see some components of manufacturing in your supply chain modules. They are I know Infor and Oracle and Workday are all working really hard to kind of retrofit to healthcare and make their supply chain modules work for the healthcare industry.
So, hey, Sophie, I heard they all have their own strengths too, between finance, human
That's right.
resources, supply chain. I heard that Workday is really not strong in supply chain. They're strong in human resources and
That's right.
finance. Is that right?
Yeah,
And so I
human
know some people are
resources.
always
Yeah,
wondering about that.
that's their core. Human resources is really a Workday's core. Finance, their finance modules are coming along really well. I've implemented Workday in many, many organizations that I work with, healthcare organizations. The same with Oracle. Oracle was not built for healthcare either, but they are working on their modules. They were built for manufacturing, and the same with Infor, built for manufacturing. But all are working to, like I said, retrofit to healthcare supply chain specifically. I think Workday is, I don't want to say doing a better job, but I know Workday is really invested in their users. They have a lot of user group interaction, and from what I understand, they have updates or enhancement sprints very, very frequently, mostly around supply chain. So I don't want to say that, you know, one is better than the other because that, like you said, they all have their strengths and weaknesses. But I know that Workday is very active in the supply chain updates.
So if you really want it to be strong in one or the other, you really need to ask a lot of questions through your RFP process of what you need
Absolutely.
it to do before you make a decision.
Absolutely, absolutely. And also, there's the clinical component to think about, right? Because most organizations also have a clinical system or that they interface with. So, an Epic, a Cerner, those systems that house all of the clinical information. And so, you want to vet the interoperability of the cloud ERP system with your clinical system. Okay, so the limits to a cloud migration. So we'll talk about that first. The cloud ERP systems are what we call out of the box, right? So they work very well as designed when you implement those solutions. Previously, the on-prem solutions were very customizable because they were within your data center, in your network, and you had specialists or subject matter experts that could build code to interface with the on-prem ERP. With cloud, it's a little bit different, right? Because it's out of the box, it's one cloud tenant, and then every organization has their own tenant within that cloud. And so, for example, with Workday, when they make a supply chain update, it updates for every customer, not one specific customer. So that's why it's sometimes challenging to build those customizations, because the ERP systems are constantly making those updates and they push out automatically. The on-prem systems would typically schedule their updates and enhancements, and you could adjust your customizations around that. So that's something to think about when you go into a cloud ERP, or if you're already in a cloud ERP. You really want to limit the customizations that you have, just because it's going to be a huge lift to maintain that customization going forward. And then the cost. So the initial cost on cloud is lower simply because you don't have the user licenses to consider. It is a subscription-based model, but you have to be careful over time that the long-term cost doesn't build because you continue to add modules or add additional systems to that cloud ERP. One of the downsides, you could say, is it is internet dependent. So you have to have internet connectivity for your cloud system to work. This does make us a little dependable on the internet across healthcare, because if you were part of that AWS outage a few weeks ago, it does kind of put a stop to things that are internet dependent. So that's definitely something to consider. And then security and access control, because your data is in a cloud, in the Infor cloud or Workday cloud, all of your data is there. However, most of the cloud organizations have very, very strong requirements for their cybersecurity and any type of access to the data that exists in their system. So that's an upside, that your organization doesn't have to make those investments because the cloud ERPs are doing that for you. However, the downside is, yes, all of your data is in that larger ERP cloud and not just in your on-prem system.
Hey, Sophie, based on Angelique's earlier question, what would you say the importance is of evaluating your other vendors with their, as far as their integration partnerships go with the cloud ERPs, given the fact
Absolutely.
that everything's pushed at once?
Yep, absolutely. That's a great point. So, as I mentioned earlier, cloud is not the answer to everything. You'll find that your cloud ERP system doesn't have all of the functionality for all of the areas and workflows and processes that you need. So, as a result, you may have a third party software or a third party integrator that works with your cloud ERP. So it's very important to know that, number one, that the third party software is interoperable with your cloud ERP system, that they can manage the updates and any enhancements that are coming from your cloud, and make sure that they do have a working partnership with your cloud ERP. I know that Workday has certifications for the third-party integrators. I know that Oracle also has the same, and I'm pretty sure Infor does as well. I'm just not as familiar with those third-party relationships. But definitely important to make sure that any of your third-party integrators are going to work with your cloud ERP. Great point, Kate. Thank you.
Thanks, Sophie.
All right. So we talked about the limitations with cloud. We'll talk a little bit about what problems the cloud ERPs do solve. So the great thing about cloud ERPs, it is a single unified platform, right? So all of your data is streamlined and you can access all of your information across your organization. Previously, historically with on-prem, excuse me, you may have had data silos that you had to have some custom reports written, or you had to have access database or a data warehouse where you could access that data. With your cloud ERP, all of that data can be accessed within that cloud system and pulled into a data warehouse if you'd like, if you have information coming from your EMR that you'd like to interface as well. But all of that information exists in your cloud ERP today. Integration and automation, all of the systems, like Angelique mentioned earlier, finance, HR, supply chain, everything is under one umbrella. Previously, you may have had one system for finance, a different system for HR, and then you had your standalone supply chain management system. That also ties back to that data and the data silos. Now, all of that goes away. You have finance, HR, payroll, supply chain, accounts payable, everything under one roof. So again, you have access to all of that data, and the data mining component of that is super valuable. And you'll have the ability to bring that data together and really, really make some decisions that you weren't able to make before with the siloed data.
Hey, Sophie.
Yeah.
I had someone in LinkedIn ask a question. They said they're curious on where the accountability should lie when things don't go to plan during implementation and problems spawn from the risk. Who ultimately should be making things better? And I know when we did our Infor Cloud, we had there was a project manager on our side and on their side. You've got finance, supply chain, payroll, accounts payable. You've got human resources. And a lot of times people are just, pointing the finger. And then we had a steering committee, we had a change control committee. What are you thinking? So many committees.
Like you had it covered. Yeah, I did see that question from John. And
Yeah.
the first thing I would say is risk assessment, risk assessment, risk assessment all day long. If you even hear the whisper that your organization is talking about cloud, start the risk assessments. Start understanding all of your workflows, where there's any manual workflows that need to be converted to a cloud ERP and automated. Because I tell you, the hardest thing to do is implement new technology, i.e. cloud ERP, and try to maintain those old processes, because when you implement a cloud ERP, you have to step back and think about how you can do things different and better, leveraging the technology that you're implementing. Because the last thing you want to do is invest in this cloud ERP system and still have people working on the outside doing things manually around the system. So back to what I said, risk assessment all day long, up front, as much as you can. Dig into every process that you can, every department, every area, and understand how this cloud solution is going to affect all of those workflows, processes, people, and make sure that you've covered all of those areas. So that would be the place to start, kind of proactively. And then reactively, after you've implemented your cloud solution, you want to go back and check all those lists and say, did we actually automate those processes? Or is there some things that were still left on the table? Because like I said, cloud doesn't solve everything. So you may still have to go shop for a third-party integrator to cover some of those areas that are still manual.
Love it.
If I
Thank you
can
for
add
answering
to
that.
that, just to add to that, Sophie, I think the other
Mhm.
thing I would say is believe your other partners when they tell you what it's going to take to walk with you through this conversion.
Sure.
So, and I get that lots of times, you talk to your other partners and you tell them you're going to Infor, you're going to Workday, you're going to
Right.
Oracle, and they tell you that something is going to have to happen and your warning bells go off and you're like, more money, more money, more money. But they're coming
Right.
to you with experience and they're
Hmm.
telling you like, this is what needs to happen or it's not going to go the way you want. And you need to believe them in that
Yeah.
because
And
they've been through this exponentially more times than you. So I would say believe your partners.
Mhm. That's a great point. Subject matter experts, they're out there. Listen to them, reach out to them, talk to other organizations that have implemented cloud, because we always say when you've implemented cloud at one organization, you've implemented cloud at one organization. It's not, while it is scalable from an ERP perspective, right? Like everyone does things slightly different, or maybe really different. And so you really have to understand what's going on in your organization, but also take a look outside of your organization to see what other people are doing. Talk to the ERP and ask their user group to join their user group even before you implement to hear the good, the bad, the ugly. So you're prepared for what's coming, because it is a lot. It is a lot. Even if like Angelique said, you went from N4 Lawson to N4 Cloud, it's still a huge change.
Hey, Sophie, this is Heidi. I have a quick comment and question for you. This is such
Hi.
wonderful information. Hi. Gosh, I'm loving this and I feel like I'm already smarter. So thank you for that. I hear a lot about where we see a lot of the healthcare consolidations with IDNs becoming larger because they're, onboarding new hospitals that they've acquired. Can you just touch base a little bit on that piece of it as well? Because let's say, the IDN is humming along, they've got a great system in place, and then all of a sudden they've got to integrate, the ugly cousin from outside into their mix, and
Yeah.
how that process works, and if there's anything that we could be aware or offer some guidance on that to make that process easier, because I've heard really a lot of struggles with onboarding when an existing system is running well.
Right. Yeah, and I will say we do experience, or I do experience that all the time with the organizations that I work with, for sure, that are on cloud, or maybe they're not on cloud and they are bringing in another organization. The one thing I will say is that the cloud ERPs do make that a lot easier, because you don't have to deploy a server. You don't have to deploy an instance of an ERP for that new organization. It simply rolls under that existing cloud tenant for the existing organization. Obviously, there's some training involved. There's a lot of people and change management involved, especially if the acquired organization is on an older legacy system, probably still doing a lot of things manually outside of that system. So definitely, going back to what I said, risk assessment, right? Like get in there and understand what that organization is doing today manually, and kind of guide them into this cloud environment, because this technology is a completely new technology if you're coming from an older on-prem system. And then also, just getting them on board with the automation that comes with the cloud ERP, because it's a totally new world when you're bringing someone into a cloud ERP and you start talking about, AI and using AI in an ERP. It can be overwhelming for someone coming from a legacy system. And it can, they can get that concern about job loss, right? Because they're going into a system with a lot more automation. It's newer technology. And so, have a little empathy when you're talking to the folks in the organizations that's being acquired, and just consider the fact that they're going through not only a change because of the acquisition, but a change because of the system and the technologies that are happening.
Awesome. Okay. My gosh. Don't mean to scare you. We got 4 minutes. How are we going to pack the rest in 4 minutes?
There's still a lot. Let's see if we can do a speed slides here. So
Okay.
a couple of the pitfalls that I talked about earlier, right? The data, the cloud expertise. We talked about the subject matter experts. Know your internal resources and understand all of those processes. If you get these 4 things right, then your cloud ERP will go well. Also think about those clinicians, because investing in the cloud ERP is not enough. You have to think about all of the integrators, all of the third parties that integrate, your EMRs that integrate. So think about all of that, and all of the third parties and the risk that you mitigate with those third parties. So like Kate said, the cloud solutions or the cloud ERPs don't solve for everything. And I'm trying to go really fast here, but think about the different areas that are not covered by your cloud ERP. So your spend analytics, your strategic sourcing, the procurement processes. So having that, Amazon type shopping experience, all of these things that may not exist in the cloud ERPs today. Contract data management. So from the group purchasing organizations, getting that data into the cloud ERP that hasn't been fully automated yet. And also looking at your data management and analytics. Your cloud ERP houses your data, but it doesn't necessarily cleanse your data. It doesn't aggregate your data. So you have to think about the ways that you're going to use the data from the cloud ERP, but get them into a tool that you can actually do those analytics. And then finally, looking at enhancing your automation. So all of those areas that aren't covered by your cloud ERP, how can you continue to build on that? And then finally, the invoice and payment processes, again, not fully covered by the cloud ERP. So you may have to look at third-party integrators for the invoice to payment processes. They can bring the invoices in, maybe not necessarily get the payments out electronically. So you may need some third parties there. And then lastly, achieving success with your cloud ERP. Again, it goes back to the data, having the interoperable platform with all of your third parties, and then having those SMEs, the subject matter experts, with your organization, and supporting you through that move to cloud. Was that 4 minutes?
And Sophie, I'm so glad you mentioned the invoice and payment processing, because that is one of the biggest gaps I see in any cloud migration.
Absolutely.
Like, for sure, you need someone to help you with that. Make sure that you're getting all that invoice automation, any rebates that are available, the data management. Like, there are a lot of things that cloud is great at, but there are
Yes.
a lot of things where you need to do your due diligence and make sure you have the right partners.
Yep. And I think that goes back to John's comment, Angelique, on LinkedIn. So yeah, I think it's really understanding what you have today, what the cloud ERP offers, and then where those gaps are. I mean, that's really it. It sounds overly simplified, but it really is that easy.
Yeah, just some contracting tips as well. When you guys are putting together your financial impact statement of making this move or doing an RFP, make sure that you put in there any different third party applications that you could possibly replace with this. Put them in your subtraction, right? Like make sure that
Right.
you're like, I'm getting rid of X, Y, or Z, and I am going to replace it with this cloud and I'm going to bring it all into one system. Make sure you put that on your financial impact statement. And then last but not least, but in your contract, you are going to want to define who your project manager is, who their project manager is, what your milestones are, hold payment until milestones are done, have accountability on both sides, have escalation pathway actually written in your contract so that it's very, very clear when the project goes upside down, who's accountable, where, how. So perfect, perfect. And you know what,
Absolutely.
I
Sophie, I
think
know you're with
just as important,
GHX
just
and
as important in there,
oh, hey,
and
Kate.
yeah,
Yeah.
just to say, you mentioned the financial impact, mention what you can get rid of, but you also have to mention what you have to add. So
Yes.
a lot of your vendors are going to have, you know, there's going to be a fee increase, there's going to be implementation costs, there's going to be this or there's going to be that. But you
Yeah.
have to think about what you need to add to get the full story. And that's why being transparent early on is important. And working with your
Agree.
other partners that are going to integrate is just as important.
Yeah, I
It's
do
not
agree
Absolutely.
with
the
that.
fact that there's some addition there too that you got to do.
Yeah. Well, and I know, Sophie, you're with GHX. And first off, I want to thank you for being such a good integration partner. When we
Absolutely.
did our Infor cloud upgrade through my organization, you guys have tools out there as well. So, not that this is a sales pitch, but if you guys have any other questions, please reach out to Sophie. She does such a great job. And Sophie, thank you for being with us here today and
Of course.
educating us all. I
Thank
appreciate
you.
you.
Yeah, I enjoyed it.
Okay, so that ends our session here today, and I hope you guys all have a great rest of your evening. Thank you for being here late with us today, and we will see you guys next week on our next Learning Bite. Thanks,
Bye-bye.
This was
everybody.
great. Thank you.
Thanks, Kate.
Bye.
Bye.